task force made significant updates to its breast cancer screening recommendations. They now say the new approach could save 20% more lives. So what does this mean for you? Joining us now is Dr. Sarah Friedwald with Northwestern Medicine. Doctor, thanks for being here. And I want to jump right in with having you walk us through these new guidelines and how they're different from what we've had before.
Yes, these are final guidelines from the United States Preventive Services Task Force, which is an organization that puts out screening guidelines. And they reversed their original set of guidelines set back in 2016, where they recommended screening every other year beginning at age 50 to now screening every other year beginning at age 40.
So I know there's a lot of talk about how mammograms don't always work as well for women that have that dense breast tissue. So is there any new concrete information about those cases specifically within these guidelines?
Well, they actually stated that the supplemental screening, which is what we would do in patients who have dense breast tissue with either MRI or ultrasound, is promising, but more research needs to be done. The federal government actually requires us to notify patients about whether they have dense breast tissue or not, which is about 40% of the patient population, and that supplemental screening may be helpful, but right now the task force believes that there's just not enough data to come out with specific recommendations.
Interesting. Okay, I want to ask about Black women. They're 4% more likely to die from breast cancer. Do these recommendations address that disparity at all?
Yes, so previously when they recommended starting at age 50, this excluded women in their 40s. And Black women tend to get breast cancer at a younger age, particularly in their 40s, and the breast cancer tends to be more aggressive. So this is actually more inclusive for those patients. And I do want to point out that these guidelines are just for average risk women, not for higher risk women. So the American College of Radiology and the Society of Breast Imaging really recommend that women get assessed for their breast cancer risk by age 25. So we know if we need to start screening earlier.
Dr. Sarah Friedwald with Northwestern Medicine, thank you for this added context and your time.